everyone, this is the Health-Related Legal and Ethical Case Study. It's by Christy Sinopong, Chardonnay Clark, and Erica Swanson.
Mental health issues are a growing concern in the United States, and millions of Americans are affected by mental health issues in a given year. The number of cases of depression has skyrocketed in the past decade, and one must consider why this is happening.
Okay, for our case study, we decided to talk about a 65-year-old man who has been experiencing sleeplessness, loss of appetite, and fatigue for the past few days. He visits a physician to speak about his unusual behavior. The man also informs the physician about the passing of one of his friends a few weeks ago and insists on getting antidepressants because he believes he is depressed from that event and saw a commercial advertisement for Zoloft. Should the physician prescribe the antidepressant to the man? In this case, one must consider the legitimacy of the diagnosis and if antidepressants are the appropriate solution. With this being said, this is the legal analysis of the case. Inappropriately prescribing medications can cause serious dangers to a patient. In this case study, the man's request for antidepressants should not be taken lightly because the side effects are dangerous, for they can range from blurred vision, nausea, vomiting, and more. With each side effect, the extent and severity of it varies with each person. Although there are no direct legal issues of the case, there are many scenarios where legal issues may come into play. For example, there was a man in New York who committed suicide. This man's family sued the physician and won, for the jury ruled in favor, stating that the antidepressant the man was taking had contributed to the man's death. In today's society, Americans tend to want a quick fix rather than spending time going through therapy, which is totally understandable, for it can be time-consuming and costly. But this mindset right here understates the risk involved when taking antidepressants. Physicians legally must follow the process of informed consent to provide patients with a clear understanding of what the medication treats and what its side effects are, and alternatives instead of taking medication. By doing so, it allows patients to have some autonomy, which will lead us into the next slide about the ethical aspects of this case.
I am going to present to you the ethical analysis of this case. Today we will talk about two ethical principles in particular: utilitarianism and deontology. When it comes to utilitarianism in this case, the physician must consider the outcome of the decisions made. The outcome of the decision determines whether it was right or if it was wrong. First, we must know that psychiatrists are no longer the main prescribers of opiates. They have been replaced by primary care physicians who have minimal training in healthcare disorders, which means there is plenty of room for many possible risks. When a physician inappropriately prescribes medications, they are putting their patients at risk of serious harm. And let's talk about the deontology of this case. Deontology focuses on the duties to others and others' rights, which in this case, the physician's obligation to duty is to determine if there's an alternative for antidepressants, such as therapy. Sometimes it can be compromised when a patient is demanding something in particular. For instance, in this case, the patient wanted Zoloft because he saw it on a commercial. Many Americans want the easiest and sometimes cheapest and quickest way out. They don't want to spend their money and time on therapy. Sometimes physicians don't inform the patient of the best option, which means this puts many American patients in particular at a greater risk to the dangers of opiate abuse. In closing this case, we have a 65-year-old man who has experienced some unusual behaviors for a few days and tied them to the death of his good friend who passed a few weeks before. After seeing a commercial about Zoloft, an antidepressant, he self-diagnosed himself and said it was depression. We can agree that antidepressants should not be prescribed as a quick fix because it's known that antidepressants have major side effects. It is the physician's duty to review the patient's medication list to see if reported complaints may be a side effect of another prescribed medication and not a result of social issues that recently been experienced. It would be negligent on the physician's behalf if he did not review the patient's medication list. Another route should be pursued, such as therapy, which has less risk and is known to be more effective. Some patients may magnify their pain, and doctors should be able to distinguish and expound the misuse of opiates.
In conclusion, older adults are a very vulnerable population. They are the recipients of 1/3 of all prescribed medications, but make up less than 15% of the population here in the United States. Polypharmacy is a great concern in the older adult population. Physicians who prescribe unnecessary medications to this vulnerable population in an effort to gain additional wealth not only defy their Hippocratic oath, but they also disregard their commitment to the ethical principle of non-maleficence, where no harm should be done and that all caregivers should uphold. An informed older adult should have the autonomy to choose whether to accept the prescription recommendations made by the physician, but the physician has the responsibility of veracity while informing the patient of the benefits and risks of any prescribed medications. It is not about satisfying the patient, but having the patient's best interest at heart above one's wallet. Therapy such as cognitive behavioral therapy and psychotherapy can be used as an alternative. The goal of therapy should not be pain relief or contentment, but to actually improve the status of a patient's functionality.
Okay, this slide right here is our reference page, just in case any of you wanted some more information, whether it's about the case in New York or just definitions or anything. And now it is time for a quiz. Below on the screen are 5 questions. Question 1. Over the past few days, the patient was experiencing sleeplessness, loss of appetite, and nausea. True or false? Question 2. Who is the vulnerable population? A. Teenagers. B. Adults. C. Elders. Question 3. The diagnosis of this case was legit and the patient was prescribed Zoloft. True or false? Question 4. Can the physician prescribing the antidepressant be liable for the side effects that the patient faces? True or false? Question 5. What defies the Hippocratic Oath? A. Prescribing unnecessary medication and self-wealth. B. Prescribing unnecessary medications. C. Quick fixes. Or D. Prescribing unnecessary medication for additional wealth. Okay, here are the answers. For question 1, over the past few days, the patient was experiencing sleeplessness, loss of appetite, and nausea. It's true. For question 2, who is the vulnerable population? The answer is C. It is the elders. For question 3, the diagnosis of this case was legit and the patient was prescribed Zoloft. The answer is false. The patient was not prescribed Zoloft. Question 4, can the physician prescribing the antidepressant be liable for the side effects that the patient faces? The answer is true. Question 5, what defies the Hippocratic Oath? The answer is D, prescribing unnecessary medication for additional wealth. Thank you guys for watching our presentation.